I'm doing hand hygiene. So here's my physician order and here is my MAR. It is March 15, 2020 at 6:10. There are no known allergies, no known allergies. There are 2 transcriber initials for each of the medications on the physician order and 2 transcriber initials for each of the medication on the MAR. So now I'm going, so here it's March 15, 2020. So Jake Nursing, FIN number 312-654-987-987. Date of birth, January 1, 1960, January 1, 1960. Dr. Nursing Skills Lab, Dr. Nursing Skills Lab. Again, there's no known allergies, no known allergies. Jake Nursing, penicillin VK, dose 300 milligrams, oral suspension, 3 times a day. Here it is scheduled 3 times today. It is scheduled for 6, it is 6:10. It has not been given yet, so it's safe for me to administer. Jake Nursing, ciprofloxacin 0.3%, ciprofloxacin 0.3%. Dose 1 drop to the left eye, 2 times a day. Here it is scheduled for 2 times a day. It's scheduled for 8, it is 6:10. I am not going to be giving this medication. Jake Nursing, ibuprofen, 400 milligrams, orally, 3 times a day. Here it is scheduled 3 times today. It is scheduled for 6, it is 6:10. It has not been given yet, so it's safe for me to administer. Jake Nursing, Deltiazam, 60 milligrams, orally, daily. Scheduled once today for 6, it is 6:10. It has not been given yet, so it's safe for me to administer. I'm going to put away my physician order because I no longer need it. I have my MAR. I'm going to do hand hygiene. Again, this patient has no known allergies. I'm going to go to my medication supply, get my medication. This penicillin VK, oral suspension. This is an oral suspension, 300 milligrams. Here is 250 milligrams for 5 ml. So I'm going to give 6 ml. I am shaking it and I am noticing that it is not expired. So. I have my syringe. The cap is on its side to remain sterility. Cap on its side. Cap on its side. So here I have 6 ml and there are no big bubbles on the inside. I'm going to put the cap away. I'm not going to be using it. Instead, I'll be using a med cup. I'm putting it on my tray. I'm going to do my label. So, Nursing Jake, penicillin, VK. Dose is 300 milligrams, which is 6 ml. This is a oral suspension. and it's scheduled 3 times a day. Concentration is 250 milligrams per 5 ml. It is March 15 at 2020 at 6:10. My signature is PCUMSN2. I'm gonna be putting this into med waste. Now I'm grabbing my ibuprofen. This is ibuprofen, 400 milligrams. This comes in 200 milligrams. So I am going to be giving 2 tablets because 200 milligrams per tablet. And I am checking and it is not expired. I'm putting it in a med cup. I'm gonna do my label. So, nursing Jake. This is ibuprofen, 400 milligrams, which is 2 tablets. It is orally 3 times a day. Concentration is 200 milligrams per 1 tablet. It is March 15, 2020 at 6:10. PCUMSN2. Now I have my diltiazem. And again, these are oral medications. Diltiazem, 60 milligrams per tablet. So I'm just going to be giving 1 tablet only. It is not expired. Nursing Jake. This is diltiazem. Dose is 60 milligrams, which is 1 tablet. This is an oral medication daily. It is concentration is 60 milligrams per 1 tablet. It is March 15, 2020 at 6:10. PCUMSN2. So now I'm going to be doing I'm going to do hand hygiene. Now I'll be doing my second check. So, Jake nursing, penicillin VK. This is penicillin VK, oral 300 milligrams. This comes in at 250 milligrams per 5 ml, so I'm going to be giving 6 ml. And again, here I have 6 ml. Route oral suspension. This is an oral suspension. Scheduled 3 times a day. Here it is scheduled 3 times a day. Scheduled for 6. It is 6:10. It has not been given yet, so it's safe for me to administer. I'm just going to be putting this back into the med supply because I no longer need it. And so I have Jake nursing, ibuprofen. This is ibuprofen, 400 milligrams. This comes in 200 milligrams per 1 tablet, so I'm going to need 2 tablets. And here I have 2 tablets. Oral medication daily. It is scheduled for 3 times a day. And I have it scheduled 1, 2, 3 times a day. It is scheduled for 6. It is 6:10. It has not been given yet, so it's safe to administer. And I'm going to be putting this away. I have Jake Nursing, Deltiazam. This is Deltiazam. 60 milligrams, 60 milligrams. This comes in 60 milligrams per 1 tablet, so I'm going to be giving 1 tablet. Here I have 1 tablet. Oral medication, scheduled daily. I wrote here daily. It is scheduled for 6 today. It is 6:10. It has not been given yet, so it's safe for me to administer. I'm going to be putting this away to the med supply. I have my medication and my labels here. So this is my medication labels for you to see. I'm just going to be putting a glass of water. I'm going to be bringing a pencil with me to sign my MAR. I know that I should be using a pen, but for this demo, I am going to be using a pencil. So, I walk into the room, and I am at the patient's bedside. So, I do hand hygiene, safety check. There's nothing on the ground to cause the patient to fall, nothing in the environment to cause harm to the patient, myself, or any other nurse. Their call bell is right next to them. They are not in distress, and they're in a comfortable position. And I say, hi, my name is Patricia, and today I am your student nurse from the University of Manitoba. Today I'll be giving you your medications. Right now, I'm just going to be checking your armband. So it says Jake Nursing, fin number 312-654-987. Date of birth, January 1st, 1960. Date of birth, January 1st, 1960. Dr. Nursing Skills Lab. It says no known allergies. On the wristband, no known allergies. I just asked them, so can I have your name? They say Jake Nursing. Here, Jake Nursing. Can you tell me your date of birth? January 1st, 1960. January 1st, 1960. Do you have any allergies? They say no. No known allergies. So Jake, I'm just gonna raise the bed to my waist level and have you seated in a high Fowler's upright position because today we'll be giving you oral medications. And just stay there for a moment and I'll be doing my medication check. So I'm just gonna do hand hygiene again. Jake Nursing, penicillin VK, dose 300 milligrams, which is 6 ml. Here I have 6 ml. Route oral suspension. This is an oral suspension. 3 times a day. Here is 3 schedules for today. It is scheduled for 6. It is 6:10. It has not been given yet, so it's safe for me to administer. So Jake Nursing, ibuprofen, 400 milligrams, which is 2 tablets, and this is 2 tablets of ibuprofen. Orally, this is oral medication, 3 times a day. It's scheduled 3 times today. Scheduled for 6, it is 6:10. It has not been given yet, so it's safe for me to administer. I have Jake Nursing, Deltiazam, 60 milligrams, which is 1 tablet. This is 1 tablet of Deltiazam. Oral medication, daily. It is scheduled for 6 today it's scheduled for 6. It is 6:10. It has not been given yet, so it's safe for me to administer. I'm just gonna clarify that I'm not going to be giving ciprofloxacin 0.3% because it is scheduled for 8 and it is 6:10. I am not going to be giving this medication. So now that I've done that, I go back to Jake. So Jake, before I give you the medication, I'm just going to tell you about each medication. You'll be receiving penicillin VK. This is an antibiotic for your strep throat. You may experience some headache, sore throat, and drowsiness, along with dizziness and sweating. With this medication, I have you assess your hypersensitivity to penicillin, cephalosporins. I have assessed any history of I have assessed any history of allergies, and you don't have any. I've assessed your vital signs, especially your blood pressure and your temperature, and I have assessed a culture and sensitivity to make sure this is the right antibiotic for your respiratory infection. With this medication, I'll be monitoring your vital signs, especially your blood pressure and your temperature. I'll be monitoring your liver and kidney function. I'll be monitoring for signs of a super infection. I'll be monitoring for any signs of allergies and asthma. And I'll be monitoring a complete blood count 2 times today to see if your strep throat has improved or worsened. With this medication, diarrhea may occur, and you want to maintain your fluid levels to 6 to 8 glasses a day. You'll also be giving ibuprofen. This is a antipyretic medication for your fever. You may experience some headache, dizziness, drowsiness. I have assessed your hypersensitivity to salicylate and NSAIDs. This is the drug class for your medication. I have assessed any history of bleeding and asthma, and assessed any bleeding disorders, and I have assessed your vital signs, especially your temperature. For this medication, I'll be monitoring your vital sign, especially your temperature, your liver and kidney function, your input and output of fluids, your daily weight, any signs of edema, so swelling in your extremities, so legs and your feet, and I'll be monitoring for any signs of bleeding. With this medication, don't take another NSAID or aspirin, and don't take alcohol. Lastly, you'll be getting diltiazem. This is a calcium channel blocker for your high blood pressure. You may experience some chest pain, headache, drowsiness. I have assessed your hypersensitivity to calcium channel blockers. I have assessed any history of heart failure, and I have assessed your vital signs, especially your blood pressure and your heart rate, specifically your apical pulse. I'll be monitoring your vital signs, especially your blood pressure and your apical pulse. I'll be monitoring your liver and kidney function. I'll be monitoring for your input and output of fluids, and I'll be monitoring for signs of congestive heart failure, your PR interval, and I'll also be monitoring for any digoxin toxicity. So with this medication, don't take another dose if your heart rate is less than 60 beats per minute, or if it's irregular, and don't take it with caffeine. And now I'm just going to be giving you your medications. This is your penicillin, the antibiotic for your strep throat. Here you go. Here's some water. Again, I have stated that the patient was already in high Fowler's position and they have swallowed the medication. Next is your ibuprofen for your fever, and it's an antipyretic. Here you go. Here is water, and I have seen that they have swallowed the medication. This is your diltiazem, which is a calcium channel blocker for your high blood pressure. Here you go. Here is some water, and I have checked that the patient has swallowed the medication. So I'm just going to have you seated in this high Fowler position for 30 minutes. I'm going to be, again, monitoring your vital signs as your temperature to see if it is if it got to 38 degrees Celsius or more. I'll be telling the doctor, and also be checking your complete blood count 2 times a day to see the status of your infection, and your vital signs. I'll be checking them every 6 hours. So your call bell is within reach. There's nothing on the ground, on the floor, anywhere in the environment to cause harm to you, me, the next nurse who comes into this room, and I'm lowering the bed to the lowest position, but keeping my patient at a high Fowler sitting position. And your call bell is right here if you need me. Ring it if you are experiencing any of the side effects or if you have any other concerns. I'll be back in 15 minutes. I'm doing hand hygiene, and I am just gonna be right here by the bedside signing my mark. So PCUMSN2 at 6:10. I'm not going to be signing for ciprofloxacin because I've not been giving it. I did not give it. So for ibuprofen, PCUMSN2 at 6:10. For diltiazem, PCUMSN2 at 6:10. And here is my signed MAR, and I am done.